Good evening, all. Today we are going to discuss about the speaking subtest. Okay, so let me share my screen. Welcome to Edu Skills International. Today's subtest is speaking, and we hope everybody knows how the reading subtest will start, right? So they will check all your identification, everything. Okay, they'll check the passport and all. Then they will start with the warm-up questions. Okay, what warm-up questions means? Introduce yourself. Why did you choose OET? Why did you choose nursing? All those questions. I'm not going to explain all those things. Hope you know regarding that. If you have any doubts at the end of the session, you can ask. Okay, there will be 2 role play cards. Okay, for 5 minutes you have to do, and 3 minutes you will get preparation time. Okay, this is tomorrow's discussion topic. So here the setting is clinic, and the patient set cue card is this one, and the nurse cue card is this one. Yes. So what is the setting here? You can also talk, no issues. Okay, no need to mute your microphone. This is a discussion, so you can also unmute your audio and video as well. Okay. So what is the setting here?
Clinic.
Clinic. Yes. Why we need to know the setting?
According to setting, we are start conversation.
So according to the setting, whether we can start the conversation, or we need to know the context also, the introduction paragraph also.
According to the setting, we can introduce ourselves.
See, you have to see the introduction part also, because sometimes not in this cue card, sometimes home visit they will mention here in settings. Okay. So what we will think? What is our role if the setting is home visit?
Then we have to think that we have to go to the patient's home.
Yeah. So what is your role? Who are you?
Community nurse.
Community. Okay. Here is the problem, because sometimes from the hospital also they will visit, okay, the patient's home. That means you are from the hospital. That means you are hospital nurse. So only with the setting, don't think like I'm a community nurse. Okay. So you have to read the introduction also. Introduction means like this, they will give the patient details here. Okay. And they will mention what you are going to do also. Correct? So whenever you are seeing the setting, don't think like you are a community nurse, you are a hospital ward nurse, or whatever it is. Okay. So especially in the home visit, balance other things are okay. Okay. So here in the setting is clinic. So here you have to read, your patient is 51 years old and has had a lesion removed from his or her hand following a diagnosis of squamous cell carcinoma. He or she was overexposed to the sun in his or her teeth. You have come to remove the stitches. Okay. So your patient is 51 years old. Here the age of the patient is there. Okay. You can ask with the interlocutor. When you will get 3 minutes time for the preparation, you have to ask the interlocutor, how may I call you, or how may I address you? All those things you can ask during the 3 minutes preparation time. Fine?
Yes, sir. Yes, sir.
Here any gender they have mentioned for the patient?
No.
No.
So in official OET cue cards or in other cue cards also, they will not mention the patient gender. Okay. Who is your interlocutor? That will be the patient's gender. If your interlocutor is male, then it's a male patient. If your interlocutor is female, then you can consider that as a female according to the condition also. Okay. So here, squamous cell carcinoma, he was exposed, or she was overexposed to the sun in his or her teens. Okay, sun exposure. Because of that, squamous cell carcinoma, and it was removed. Okay, and she came, he or she, okay, come to remove the stitches. Then what is our task? So you are the clinical nurse. You got an idea. Who are you? You are a clinical nurse. Okay, in clinic, you are a nurse, and you can move to the task. Here, first task is confirm reason for visit. So how do you start the role play? Any idea?
We can start. Hi, good evening. How can I help you? After that, we can recognize the patient, because they're not visiting first time. They frequently visiting. No, before also they visiting for some dressing or something. May or may not be. We know about the patients.
Yeah. So here it is not clear whether you know the patient or you don't know the patient. Well, maybe in the clinic you are a new nurse, you don't know, right? So how can you start? It's here, the confirm reason for visit. So you have to confirm the reason for visit, correct?
Yes.
Yeah. So how can you confirm it? Anybody else?
Actually, I wanted to say that nurse should have to ask to the patient now. Could you please tell me what is the reason why you have come here, or how may I help you?
Okay, fine. Okay, good.
Not only that, the personal details can be collected as well, because we don't know the patient. We must know the personal details also. What is his name and so on. Other things also.
See the name, you can ask when you will get 3 minutes preparation time. If you forgot to ask the name, what you can do for the identification, could you please restate your name? If you forgot then to ask the name in the preparation time, okay, 3 minutes preparation time, you can ask in a neutral way. Okay, that means you know the patient name, but still you just want to, for the confirmation, you are just asking like, could you please restate your name? So here the task is confirm reason. Confirm means you know the reason, but you need to confirm, right?
Yes.
So,
yes, ma'am.
Yeah.
Okay. So
Yes,
you have to, you can just say hi, good evening or good morning, whatever it is. Most of the time it's good evening, right? Or good afternoon, whatever. Okay, fine. So you can introduce yourself, right? And you can start this. If you are not introducing also, it is fine. Why? You have come to remove the stitches. Okay. So if you introduce also fine. If you're not introducing also, it's fine here. Okay. And you're just confirming the reason for visit. Removal of stitches. You can just tell, hi, consider the patient name is Maria. Okay. So you can just confirm, you can just tell, hi, Maria. I'm Arya Anand and I'm the nurse today. Or like that. If whatever it is, if some of them are saying like, I'm one of the registered nurses working in this clinic, all those things, it's up to you. Okay. So no need of that long sentence and all. You can just say, I am the nurse on duty today, or a simple sentence is enough. Okay. Hi, Maria. So you can just introduce yourself and you can just say, so hope you are here for your stitch removal. Am I right? That means you are just confirming the reason for visit, correct?
Yeah.
Okay. Then, okay, after the removal of stitches, I'll clean your wound and I'll redress it. Is it fine? You can ask. Okay. Then find out if patient has any concerns. So what you have to ask to the patient?
If you have any other concern.
So before moving further,
Yeah.
could you please tell me if you have any concerns? Okay, you can ask. Then you can move to the second task. Give information about squamous cell carcinoma. Okay. So here in the patient cue card, see here, in the patient cue card, when asked, say the doctor told you that had something called squamous cell carcinoma, which you think is just another name for skin cancer, you are a little worried. Okay. You are a little worried. So what does it mean? The patient, the doctor told to the patient that she's having squamous cell carcinoma. And she is thinking like it's another name for skin cancer. So because of that, she is a little bit worried. Correct?
Yes,
Yes. So what you have to tell, give information about squamous cell carcinoma. You have to explain what squamous cell carcinoma is. You have to tell the patient, okay, Miss Maria, no need to be worried about that. I'll explain you in detail regarding the squamous cell carcinoma. So it's a type of skin cancer. Okay. Then what the other reasons you have to explain? Caused by sun exposure, ultraviolet radiation, etc. So whatever you need to tell, everything is there in this bracket, right? So you are just making a sentence and you are just performing that, correct?
Yes,
Then what is the next task? Reassure patient about the effectiveness of surgery. Okay. So already the surgery has done and the lesion is removed. Okay. And you have to inform cancer is unlikely to spread. All those things you have to inform the patient because the patient is worried about that squamous cell carcinoma. So you have to give a clear information about all those things. So you have to include all this caused by what is the cause. Okay. You have to reassure the patient. Then stress importance of patient skin monitoring. So what you have to inform? You have to inform the importance of skin monitoring. That means check for new changing spots, regular doctor checkups, etc. So you have to inform the patient. Okay, you have to inform the patient. You need to check for any new spots or any changing spots. You have to check, and then you have to visit the doctor regularly. Okay, all those things, checkups, all these things you have to inform. So give information about squamous cell carcinoma, it will be finished. Then what is your next task? Resist request for information about further surgery. Example, patients to speak with doctor, find out about patient's habits, when is sun, sunscreen, hats, etc. So here in the patient task, say you have a better understanding of squamous cell carcinoma. So when you will inform all these things regarding squamous cell carcinoma, the patient may say, okay, now I understood regarding squamous cell carcinoma. Fine. Then ask if you are likely to need more surgery to remove other lesions in the future. So the patient may ask whether any further surgery is needed for me if I have any future lesions. Correct? So that time you are just informing them. What, I'm not the right person to tell you regarding this. So before that you can say, I'm sorry to tell you that I'm not the right person to tell you regarding this, or I'm not the authorized person. And the doctor will explain you very clearly about this. All those things you can inform, correct? Or else you will tell, okay, it will not come like that. All those things you will inform, or what you will inform. Are you following me?
Yes, ma'am.
Yes, ma'am.
Yeah, what will
ma'am.
be your answer? Definitely you will say like that, no? I'm not the
Ma'am, in
authorized
this
person.
kind of scenario, whether we can tell them like when you're consulting next time, we can just find out from the doctor regarding these things.
Yeah, you can definitely say, because no, you are not the right person to tell about the further surgery on all, correct? So you have to inform them in a polite way. Don't tell like, no, I can't tell you. All those things don't use, okay? So you have to inform them in a polite way. Okay, I'm sorry for that. I'm sorry to tell you that I'm not the right person to inform you regarding the further surgeries. So definitely the doctor will speak to you. That time you can confirm. Like that, you have to inform very politely. Fine.
Okay.
Then find out about patient's habits when in sun. So you have to ask the patient. Okay. You have to collect the information regarding sunscreen, hats, etc. when the patient will go out. Okay. When the patient will expose in the sun. You have to confirm whether she's using sunscreen or hats, etc. Fine. Then stress need for ongoing prevention. Example, continuing to cover up when the sun, prevention of further damage, etc. Find out about patient's wound post-surgery, any pain, discharge, etc. So your fourth task is stress need for ongoing prevention. So you have to inform. Okay, continue your sunscreen, continue to cover up all those things. She has to prevent the exposure of sun. Okay, so all those things you have to inform her. Then find out about wound post-surgery, any pain, discharge, etc. So after the surgery, any pain, discharge, or anything you have to confirm, right? Then emphasize reasons for removal of stitches now. Okay, definitely the patient will have the concern whether you need to remove the stitches now or it will be very early. Like that question will come from patient side. Here, say you will make sure to look after your skin from now on. When asked, say your wound has been fine. There is no pain or discharge, but you still think it's too early to have the stitches out. Okay, the patient concern is it's too early to have the stitches out. So from the nurse side, what you have to inform, emphasize the reason for stitch removal now. Okay, removal of stitches now. What you have to inform regarding the wound healing. Okay, and assess by the doctor. So the doctor assess about the wound and the inform informed to remove that. So all those things you have to explain to the patient. And the time period, 7 to 14 days. Okay, so usually we will remove the stitches within 7 to 14 days. All those things you can explain to the patient. Fine. Okay.
Yes, ma'am.
Then advice on aftercare. So aftercare, what are the aftercare you have to inform the patient?
Keep the clean wound and clean and covered all the time as much as possible. Try to dry it.
Okay. Yeah, all those things you have to explain. Then establish patient consent to remove the stitches. So already the patient have the consent whether this is whether it's the time to remove the stitches. It's too early. So the patient have this concern. So definitely what you have to do, you have to get consent from the patient. You have to ask the patient whether I can remove the stitches or not. Okay, definitely. In Western culture, they are following the policies like we have to ask permission from the patient. So you have to confirm whether the patient is okay for the stitch removal. Fine. These are the 5 tasks you have to complete. Confirm, give information, resist request, emphasize, and stress the need for ongoing prevention. So any doubt in this role play card, you can ask.
You said that in the home visit setting, we don't use the community. I'm one of the community nurse working in this community center. So only in the community health setting, community health center setting will use only community nurse.
Community health setting, you can use community nurse. Sometimes from the hospital also, they will do the home visit. So if the setting is home visit, you have to read.
So if the nurse is from the hospital, so in that manner, we'll have to say that I'm one of the registered nurse.
Yeah, definitely, because you are from the hospital, no?
Okay, ma'am.
You are from the hospital, so definitely you have to inform, like I am from which hospital or whatever if they have given. Otherwise, you can tell I'm a nurse from the hospital, which the surgery had been performed. All those things you can just mention. But in the community setting, then definitely you can say I'm a community nurse. So I am just informing that whenever you just saw the setting, don't think like you are a community nurse, you are a hospital ward nurse, you are a clinic nurse or whatever it is. You have to read the introduction part also. If you're not reading the introduction part, you will not get a proper idea. Because only with that setting, if you are saying like I'm a community nurse or I'm a hospital nurse, whatever it is, sometime in your introduction, it will not be like the same. Okay, so in the introduction, they will give like you are from the hospital or the patient's doctor informed to visit the patient's home. All those things they will mention in the introduction part. So always you have to check your introduction part also.
Yeah, that's fine.
So any other doubts?
Ma'am, I've seen some few cue cards stating that the patient's task will be like the patient will task like he should be completely adamant towards the nurse's topic, whatever he speak in the initial stage. Only in the final, they must have given the task for him like, okay, accept whatever the nurse's advice is. So in the first itself, for the patient task, like whatever
you are talking
we advise,
regarding the reluctant patient.
Yes, ma'am. Like almost like in the between, like whatever will we tell, and if they don't accept, then what will be the situation then?
Yeah, if it's rarely you'll get the reluctant patient cue card, but still, if the interlocutor is like that, definitely in their cue card, in their verbatim, they will mention like that. Okay, at last you can agree whatever the nurse is saying, or it's like that. Okay, so you have to be polite till the end. You can't
In
shout,
the sense, like always, whatever we are telling, suppose he's not been accepted, I should keep changing my ideas, or what it should be like.
It should be in your cue card, what you have to say. Okay? Whatever is there in your cue card, only that thing you have to tell. Okay? And you have to be very polite in that situation. Because their intention is to to be reluctant. Correct. So you have to be
one
more
of the cue
polite
card,
and yeah. So
I have come across.
Okay.
That was a alcohol dependence syndrome, I guess, because the patient was like completely reluctant to whatever we advised. And the end, they were given like, you should accept the advice to the nurse. So till the 3 points completely, he should be like reluctant. So that's what I asked, like if those type of cue card comes, like what would be the situation, like how we should react. Sometimes like we change the point, like we keep changing one or the other situations, right? So how we should do it?
Yeah, don't change one or the other, because whatever is there in the cue card, that you can use. Definitely they will explain what you have to inform. Like they will mention, they will give the task according to that. Because as it is a reluctant patient, definitely they will give the cue card, they will give the task according to that. So definitely you will get an idea what you have to tell. Okay? Because if you are asking a question, the answer will be in the interlocutor's cue card, right? If the
Yes, ma'am.
interlocutor is asking a question, the answer will be in your cue card. It will be like that. So
Like that.
whatever task they are giving in your cue card, the answer will be in that interlocutor's cue card, or the question will be in the interlocutor's cue card. So no need to be worried about that.
Okay.
Okay, this cue card
Yeah.
will connect each other.
Yeah.
So don't think like, oh, what I have to do. See, we are not supposed to be tensed. That's it. If you are cool, then it's fine. And try to avoid some like medical words. Okay, if you can say everything like simple language, okay, it's in the layman's language, then it's fine. You'll get good score. If we are using more medical terms, all those, because we are just talking to a layman, and definitely we have to use that language.
Yes, ma'am.
Yes. So others, could you please unmute your video if it is possible? Just want to see everybody.
Okay, ma'am. Is there any hard and fast rule to complete the all task points which they have given to us?
Yeah, whether it is necessary to complete the 5 tasks. That is your question, right?
Yes.
Yes. So if you can complete it, then it's well and good, because they are giving only 5 tasks, and definitely there's 5 tasks for 5 or 6 tasks. It depends. Okay. So only 5 minutes you'll get, you and the interlocutor. Okay. So both will share that 5 minutes. Maybe you'll get 3 minutes or 2.5 minutes for from your side. Correct. So 5 minutes for both the role plays. So it's better to complete the 5 tasks. If it is not completing, don't be tensed. Whatever you have done is fine. Don't be tensed. Oh, I didn't complete the first cue card. I didn't complete the task. So what I will do in my next cue card? Don't be tensed. It's okay. Cool. Okay. But definitely try to complete it. But if it is not completed also, don't tense. Fine.
Got it. Got it.
It's okay, cool.
You.
You can, the other cue card also is there. If you are tensed, it will affect your next cue card. Okay.
Ma'am, if you are not completing the task, then again there will be like a band decreasing or something like that, kind of decrease in band.
Band decreasing in the sense, we have many criteria for the correction, right? For your score. So in that, it will feel like your conversation is incomplete. Okay. So if you are completing your 5 tasks, that's why I'm saying if you are completing, it's fine. But see, they are not checking your medical medical knowledge. Okay. They are just checking your English language proficiency. So if 5 tasks are there for you and 4 have completed in a good way, good language, then it's fine.